there's an interesting story here involving Central Health. That's the hospital district. If you look on your property tax bill, you'll see that you're required to pump a bunch of money into the hospital district. It's something that voters approved Mayor Kirk Watson's hospital district back in the early 2000s. Been collecting a lot of money since then. And the money was supposed to take care of poor people, homeless people, poor people. They could go and get all kinds of free services. Well, this week, the Travis County Commissioner's Court received a troubling and rather confusing report on an audit that it authorized back in 2022 of the county's healthcare district. Well, Central Health audit consultant Mazars, they found that Central Health has committed no legal wrongdoing and has improved transparency, though there were areas in which it could improve, especially in financial reporting in particular. The commissioners, the auditors, the speakers disagreed on displayed some serious confusions about one key issue. The $35 million that taxpayer dollars that the commissioners' court authorized to go towards indigent health care was instead used for education salaries and other non-clinical purposes at the UT Dell Medical School.
Well, that's not good.
This is a big deal.
Yeah.
This is not what the people voted on, right?
No.
Fred Lewis is front and center on this story and this audit and kind of this investigation. He's on the live news line. Fred Lewis, please catch us up to date on this one. What do people need to know about this? What are some of the most disturbing sides of this audit?
Good morning.
Yeah.
I guess the first thing folks need to know is that the public, healthcare, and taxpayer advocates have asked for 8 years an answer to the question, how much health care poor people received from the $35 million in annual payments that go from Central Health to Dell Medical School. It is now $385 million.
Wow.
And it is under a contract to be another $490 million, which would make it $875 million. We have asked repeatedly for this information, and frankly, it's a pretty simple question. We gave you this money. How much health care have you provided? Well, the audit report was essentially a whitewash. And let me tell you the inconvenient facts, and they're indisputable, okay? First, the money that goes to the medical school from Central Health is treated as a gift. It is not restricted funds. It's a gift. As a result, the University of Texas uses it as a slush fund without any reference to the care for the poor or to the statute. That's also undeniable. There is an incredibly weird provision in the agreement that says that Central Health can't audit the medical school for how it expends the funds. And this was all documented by me. It's all in public information. It was all sent to Mazars, and they didn't include it. One last thing. We know how much money has been spent on health care. Mazars just didn't want to answer it because it's an inconvenient truth to the local establishment. And that's it. UT is required by national standards to classify each expenditure in its budget. 90% of the expenditures Central Health funds by the medical school are for education and research and administration that's not clinical care.
Wow.
Only 10% is clinical care or administration. And after 8 years, we know they have no records of any medical care actually provided to poor people. So the answer to the question is zero medical care for poor people.
They can't say a number of people they helped, maybe not specific type of care, but nobody. They've helped nobody with that money.
That they funded a medical school.
Wow.
They did not fund health care for poor people.
That is not what the people voted on when they created Kirk Watson's hospital district. That's not what they voted on.
It's even worse than that. The Constitution prescribes what a hospital district can do, and its mission is to provide health care to poor people. That's it. The statutes prescribe its mission. And the ballot measure said that the increase in taxes would go for improved health care service, including funds to the medical school consistent with Central Health's mission. Well, there's no problem if the $35 million were used by the medical school for poor people's health care. But it's hard for me to understand if you're paying for the admissions officer to review medical students' applications, how that helps poor people.
Yeah.
It doesn't.
That's a good
really
point,
doesn't,
man.
yeah.
So what's the recourse here, Fred? What happens next in this? I mean, is there a lawsuit that's going to be filed? What's at the very least, those in charge of the hospital district and Travis County Judge Andy Brown, who leads the commissioners court, should answer to these questions, right? Speak to the people on it.
Well, we have filed a pro bono lawsuit. I will not get paid a penny, but I've been doing it for many years because I find it disturbing that this has gone on and that no one in the Democratic establishment really wants to address it. But it's real simple, and the county commissioners can do it, and they've been told how to do it. You declare the contract with no financial controls and no legal restrictions, and that's not in compliance with the Constitution. You declare those provisions illegal, and you require the money to be spent going forward on the poor, and you require financial controls to ensure the money is spent that way. But the only way they can do that is they're going to have to get outside counsel, because the county attorney represents Central Health for pay and, frankly, is complicit in this.
Is Kirk Watson's law firm part of this as well somehow, some kind of connection at all?
Yes. When Mayor Watson was a partner at Hush Blackwell, a non-contributing partner, or non-contributing partner at Hush Blackwell received $3 million to advise Central Health on the relationship with the University of Texas, and they drafted this abominable affiliation agreement.
Wow. So he may have indirectly benefited from that.
No, I don't think it's that he indirectly benefited, because he wasn't a partner in sharing the funds. He got the political result he wanted, which is funding for the medical school, and didn't really give a damn that it violated the statute, the Constitution, and the purposes for which taxpayers thought the money was going.
Man, he's good at getting this city into lawsuits, isn't he? Man, oh, man.
Yeah.
Good grief.
That's something we don't have a problem doing.
Fred, keep us up to date, man. I appreciate you checking in this morning. I know it's not, the most flashiest story, but it's a lot of the people's money, and it's not going towards what the people voted on.
Of what's wrong with local governance.
Absolutely. 100%. Fred Lewis, thanks, man. I appreciate you checking in. We're up against the clock here. We'll talk to you soon, Fred. Thank you, man.
Thank you, Fred.
Appreciate it.
Come to be here.
It is 7:29 here at KLBJ.
The Todd